Introduction I ever got. Sorry, guys, I was sitting in the back because when Denise originally invited me to this conference, she told me it was May 30th and 31st, so I hadn't written any slides yet. So I was back there trying to write a presentation. Unfortunately, I don't have any slides, so you're going to have to put up with me. Oh, hi, camera. You're going to have to put up with me as is with no slides. So this could either be 15 minutes of great pleasure or what seems to be an hour of great pain. It's up to you, because I'd like to make this about you a little bit. First of all, Denise, thank you very much. Merci beaucoup for inviting me and asking me to participate. This has been a fantastic conference so far. A couple of housekeeping notes from me. Number one, who here has a mobile phone with them? Who here has ever been at a conference where they've been told to shut their mobile phone off? I'm going to say keep it on. Right? And I'm going to say keep it on for two reasons. One, this is sort of a mobile conference, so you're probably going to be tweeting or doing your work or saying this guy's an idiot up on stage because he doesn't have any slides or whatever you're doing. That's fine. But I also judge people on their ringtone. So I don't want your phone silent either. I want to hear the best ringtone, and there may be a present for this. The poster winners may not have gotten a present, but the best ringtone keeper may. But I'll tell you something. The best, or the first ringtone is usually one of those old-time phones. Just so let's see if the first phone that rings is truly that old-time phone. Second thing, how many of you have an iPad right now that you're using connected to Wi-Fi? Oh, this is awesome. This is going to go to Bercie's point of crowdsource. You've all been curated, so you all belong here. How many of you have ever heard of an app called Hologram? H-O-L, one person because I told her to. H-O-L-L-E-R-G-R-A-M. Please download it now, because you're not going to be doing anything else. You're not even going to listen to me. But this will let you tell me how I'm doing. For instance, you can put up something that says, I have unfollowed you already. There are other great tips that you can say to me without being loud and yelling it out while I'm giving a talk. So please, if you'd like, do that and talk to me during this presentation. Next point. I want to make this about the you part of Doctors 2.0 and you. So I'm going to give you a chance now to yell out to me what you'd like me to talk about when it comes to the intersection of medical education and mobile technology. Anybody, anyone. You could yell it out. You don't have to raise your hand, Kathy. And you know what's great? Every panel didn't get to your question. So I want you to tell me first.
Yes, what I wanted to tell you is that last week we had...
I only have 15 minutes. Make it fast.
Yeah. Last week we had a presentation on a patient-doctor relationship online course.
Okay.
I feel this is nonsense because students have to see patients, not online.
So your point is make sure I talk about how online and mobile technologies don't take away from education.
Only.
They shouldn't be only. Okay, I can do that. Anybody else? ROI. ROI, that's French for king, roi. Listen, American makes a French joke. It's pretty big news, right? Yes, ROI in medical education. It's called learning and better patient care, but I'll get into a little bit more about that. What else? Educating the patients. Great. Thank you, John. Anybody else? Compassion for care. The organization Compassion for Care, or the idea of compassion for care? As a part of medical education. Critical. I will. And if I forget, raise your hand and say you forgot, because I want to.
Challenging accrediting
challenge in accrediting online CME globally or just in Canada? US. US. America. I'm familiar with that place. Is there an Instagram for health? So you're saying at the moment of treatment, take a picture of some disrobed patient and put it up for the world to see? Very disrobed. Okay. Is there a way for crowdsourcing and use of case-based education in medical education to improve patient care? I think I can get to that. I encapsulated that for you? Yeah, well said. I think we can do that. Co-creation? Got it. Like that one. Anybody else? I'm down to, I've used up 1/3 of my time already. This is great. When you don't have slides, just let the audience rule. Is that it? All right. That's multidisciplinary education. I'm sorry, this is only about doctors 2.0 and you, so the other guys don't count. I'm kidding. I'll talk about multidisciplinary. I will, I promise. Anybody else? If you could use up the rest of my 10 minutes, it'd be great. I'm kidding. All right. So I wanted to start out with a little thought. And by using this thought, I win a dinner, okay? My love for the use of mobile technologies in medical education is infinite. My patience for getting it done is finite. Meaning, we know we should be doing this. But it's taking us a very long time to actually be doing this. Now, I'm kind of glad that I didn't prepare any slides. I'll tell you why. I was going to talk about patient journeys and learner journeys, but guess what? That's been covered. And I was going to talk about the who, what, where, when, why. That was kind of covered a couple of times. I'm going to try to encapsulate and synthesize all of that along with the points that you guys just brought up in the next 9 minutes and 15 seconds. You ready?
Yes. Oui.
How do you say, are you ready in French?
Êtes-vous prêt?
Are you ready? Oui. Okay, here we go. There's 2 journeys that I like to think about. There is that patient journey, but that patient journey doesn't occur in isolation. That patient journey can be lonely, it can be scary, but it could be improved. Medical education may be what can improve that patient journey. There's also something that we haven't talked about a lot here, and that's the learner journey. The learner journey is the journey of the multidisciplinary team. Check off that one point I got. The multidisciplinary team, physicians, nurses, pharmacists, diabetes educators, allied health professionals, caregivers, who impact that patient all along their journey. Those curves intersect over and over and over. Each one of them represents an opportunity for us to improve care, speed up care, and improve patient outcomes, which to me is the ideal ROI in medical education. That's point 2, right? See, I'm getting to all of them, Len. You were worried. Please do. And if I forget any, tell me. So how can we speed up the intersections and improvement of those individual points? It's about the point of care, right? Because the where of the use of mobile technologies in medical education really is at the point of care. It's important to think about where we put the emphasis. Is it on the point of care, because we're worried about the care, or is it about the point of care? It's really both, isn't it? That was a question. Yes, we. I'm not going on unless you say yes or we. Yes. Should I go on? Barely. Okay, I'll go on barely. So how do we do that? Well, let's think of the learner journey for a second, because we've really talked a lot about the patient journey. There's the learner journey. Where do they get their education? How do they get their education? How do we make sure it's appropriate? What should it be? How do we deliver it? And how do we measure so that we know it works? Well, what's the first step in education? It's measuring the needs of the learners. Biggest mistake that I have seen through the years in any form of medical education, mobile technology focused included, is developing really fantastic education that doesn't meet a single need of the learner. right? So maybe one of the other stakeholders has a reason for developing education. Maybe there's a new product to take care of a disease. But if we don't find out that there's a real need in recognizing that patient, co-managing that patient, referring that patient, that education won't have a purpose. It won't be relevant. So we have to start with that needs assessment. Guess what? Mobile technology will help us to do that needs assessment. We can use a variety of apps and other techniques to reach the healthcare professionals and the patients. There's that other point, right? The co-creation, right? That's 4? 3? 4? Okay. Because we need to ask them at the point of care what the challenges are. What are the barriers to appropriate diagnosis? What are the appropriate methods for treatment? Where do you look for your education? What form works? How long should it be? There is no shortage of education online that's 2 hours in duration. How many of you will sit in front of a computer monitor for 2 hours to watch somebody do what I'm doing right now on a screen? 2, right? 2 out of however many. That's probably representative of our learners. Our learners also need things fast and at the point of care. If they say, how do I manage this patient with acute coronary syndromes, and I have the question now, we can't have them wait 2 hours or search through content until they find the right way to manage it, because the patient will be dead. So mobile technology offers them the ability to not only tell us what their needs are, but reach and get that content right away. How else can mobile technologies help medical education? Well, maybe people will be able to be aware of education. It may be that the EndoGoddess app, and by the way, I learned from EndoGoddess that I have the texting habits of a 16-year-old. Anybody that knows me knows I hypertext, right? But maybe we can incorporate in existing apps like EndoGoddess, like StreamingWell, like Vidium, like all of these things that you're hearing about, the ability to search for education. Because physicians are also consumers, and they're looking where their patients are also looking. They may not admit it publicly, but they are. They get as much from the Wall Street Journal as they get from the New England Journal, and we have to make sure that we're covering that spectrum. Okay? How else can mobile technology help? Well, they can get their education. It could be interactive, and it could give me, as an educator, the ability to read and get information as well as push it out. There's 2 things that we have to do in education so that we can get the ROI for whoever may have funded it. We have to do formative assessment, which is assess during a course and say, are we on target and are we educating these people? We can do that by asking questions using mobile technology during a course. And we have to do summative assessment, which is at the end of a course, not just did you like it, I hope you liked it, but did it make a difference? Did it change your competence, your performance, or your patient outcomes? Guess what? By using multiple applications, by using the right educational design, you could measure changes in patient-level data very simply. That's the ultimate goal of medical education, is improving patient care. Would you agree with that? We would hope so. We hope that your doctor goes, takes a course, learns something, and takes better care of their patient. What's the last thing that we can use mobile technology for in medical education? It's doing that assessment, right? Because when we measure everything at the end of a course, what else is it telling us? It's telling us what else we should be teaching them about. Did we hit the mark? You ever see a course and it says at the beginning, at the end of this educational course, learners will be able to, and there's a list of things, discuss, describe, better treat, et cetera, et cetera. Well, I need to measure how well each of those was hit. And if we didn't hit it, I need to put together some education that's going to change those things in the next course. MedEd doesn't occur in isolation. The multidisciplinary team needs to be educated together. If we find there are gaps in communication, we have to teach them together. Sometimes the biggest gap is how 2 physicians take care of 1 patient. When you go to a GP and a specialist, if they don't have the right dialogue, you think they do, but they don't. Nobody teaches them how to talk to one another about the patient that they're managing. Sometimes electronic medical records help them do that, but if you don't have EMR or they're not used well, guess what? There's no dialogue between the two. The specialist may have an expectation that the GP did something. The GP probably thinks, I don't have to do anything. I'll send that patient to the hospital or to a specialist, and that patient care is not good. Sometimes the education we have to develop, we learn through using mobile apps and deliver through mobile apps, has to focus on just teaching them to talk to one another. Or maybe they just need a simple tool within their education in the mobile setting at the point of care to optimize a referral or co-management. So when we think about what mobile can do for medical education, it can impact the entire timeline from thinking about what education is needed to making sure that it was on the mark. And it looks at those two patient journeys, the patient journey and the learner journey, and we optimize them so that the patients do better in the end. In the last 30 seconds that I have, I'd like to just leave you with one thought. You can do a lot, no matter who you are, to impact the education of physicians. Patients need to be a part of it. Pharma needs to be a part of it. Educators need to be a part of it. We can work together to develop good education, to deliver good education, to measure the impact of the education, but we have to do it together. 3, 2, 1. I'm done. So it gives me pleasure to introduce Denise with the next panel. But before I do, what I realized is no one's actually properly thanked Denise for the hard work that she's done. So a few of us got together, and we got you a little something just to thank you for the last 2 days of hard work. Ladies and gentlemen, let's thank Denise for what she's done.